Hello, hello, hello. Good afternoon. Good morning to everybody. Good afternoon. If you are seeing me in the afternoon, if you are seeing me in the morning, good morning. If you are seeing me in the afternoon, good afternoon. If you are seeing me before bed or at night, good night. Welcome to this channel. If you are new here, my name is Krista. My last name is DeRosier. I am a licensed clinical social work, and what we've been talking about is mental health. That's what we've been talking about. Every video there is a different topic, there is a different subject. Like I mentioned, I have done this video in Creole as well. I'm doing it in English as well for my people, for the Haitian community. If you do speak better English, you know, this can be helpful to you. Or if you want to share it to someone who speak English better than Creole, then you can also share this video. I also have the same video, the same information in Creole. So if you hear it in English and you do want someone in Creole to listen to it, you can go ahead and find that video. And I'll make sure I put, like the number of the English and then the number of the Creole, so you know exactly which video that matches. So let's do it. So today, the topic and the information that I wanted to provide it is I want to go over some phrases and some words you might hear in the mental health world, one should I say. And then I also want to mention some providers you might hear into the mental health world, and as well as some treatments of mental health. So some of the phrases you might hear mental health well-being, you might hear mental health, you might hear mental wellness, you might hear mental illness. Let me slow down, let me go back and explain what those things are. So mental well, you might hear, oh, mental well. So if someone say mental health, well, that's mean, you're good, you're okay. Mental well-being, that's mean we are continue taking care of our mental, because like I said in my last video, in my first video, and this is not going to be the last time you hear this from me, is that our mental health, it's not something that you do and you put it there and you're done. Your mental health, it's something that you continue taking care of, just like you continue taking care of your dental, you continue taking care of your physical health. It's a continuation of caring. You might hear mental illness. So mental illness, you have a illness of mental, just like it said. You might hear mental disorder. So mental disorder, it's when they're actually giving you a specific of what is your mental illness is. Or maybe mental disorders with the S. So there's people who've been diagnosed with multiple mental illness. It's not just one. You might also hear behavioral health. And many people using behavioral health, it's because when we have a mental illness or mental problem, we might see certain behavior that matching the mental illness. For example, if let's say I can't sleep and I try so many things to sleep better, but I'm unable to sleep, that's a behavior that might be the outcome of a mental illness. So that's a behavior. You might also hear substance use. Substance use, it's individual that have a problem with substance. And how do we determine that you have a problem with substance? And again, maybe I'll do a different topic just to talk about substance use. But how do we know you might have a problem with substance is if no matter what, regardless of the consequences, you are unable to stop using the substance. For example, regardless of what happening, you are unable to stop smoking. Your doctor might telling you look, your lung is failing, your kidneys attacking. Your doctor might telling you it's 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 not good for your health. This is happening. You might be spending money. Your family might not even want to be around you, regardless of what's happening. Negative consequences, you're still unable to stop. And then what you might hearing in the mental health world is addiction. So yes, there is a difference between there's a slight difference between substance use and addiction. Because in addiction, you might be addicted to anything. Some people might be addicted to exercising. It's not a substance use, but you're addicted to it. And in addiction, it's pretty much the same definition of substance use. It's like you're unable to stop something regardless of the bad consequences. And it's causing you to function unwell in your life. You might also hear healthy mind, you might hear mental health condition, or you might hear psychiatric disability. Psychiatric disability, it's when that person, like their mental health, it's they're unable to function commonly, and sometimes they need some extra support, and they're disabled to do it. Okay, so there's quite a few language and quite a few phrases you might hear in the mental health world. If you have any questions regarding ones that you heard in your community or with your doctor or anything like that, and you want to ask me below, you can leave a comment and I will read, I will see, and then I can discuss and explain. I do want to create video and answer you guys' question if you have any. The other part I wanted to talk about in this video is providers that might be a part of the profession of mental health. So I'm grabbing the main ones, but there's quite a few different ones. So the first one you might hear is psychiatrist. So psychiatrist is individuals that actually go to medical school, but they go to the mental health round. And they go to medical school, and they are the ones who evaluated an individual, and they provide you with a mental health disorder once you evaluate it, and they are able to provide medication. Some very, very little psychiatrists providing therapy. But lately, they have been doing a lot of psychiatrists have been going the extra mile to learn some therapy and also providing therapy. But mainly what they do is providing medication to manage or treating a mental illness. You might hear psychologists. Psychologists, they do have a doctor degree, but as psychologists, they don't go to medical school and they do not prescribe medication. Again, maybe there's very, very little, but they have to go that extra mile. Or they have both degree. They have psychiatrists and psychologists. They do require a license for psychologists for them to provide therapy. The other term you might hear is LCSW, which is licensed clinical social work. That's what I am. So a licensed clinical social work, they are able to provide a therapy with every other thing. So what's different about a licensed clinical social work with psychologists is we do not have a doctor degree. We do not have a doctor degree, so we didn't keep going. Some clinical social work do keep going and they end up having a doctor degree, but they will have that credential. They will say licensed clinical social work, and then they will say the doctor degree at the end. But most of us do not have a doctor degree, and we do exactly what a psychologist does. The difference is sometimes we're very broad. A licensed clinical social work is very broad. We do multiple things. Therapy is not the only thing we can do. And you can hear licensed marriage and the family therapy. So those individuals, they focus more into marriage, they focus more in couples therapy, family therapy. Those are what they focus more, but that doesn't mean they cannot provide individual therapy, and that doesn't mean they cannot provide other type of therapy. But it's just that the degree focus more in marriage, couple, family. They focus more on that. and you can hear licensed mental health counseling, LMCH, licensed mental health counseling. And those individuals, they focus completely in mental health. They are not board like licensed clinical social work, and they also can provide therapy. So LCSW, LMCH, LMFT, and I'm forgetting, some pastors also can provide therapy. I think I forgot what their credentials, something CCFT, but there's some pastoral that they do have a degree that permit them to provide therapy, and they are able to provide therapy. A lot of different churches have some pastor that provide therapy to their members, and all four of those individuals, they cannot prescribe medication. They do therapy, they cannot prescribe medication. The last part that I wanted to talk about on this video is how can we, like, what different kind of treatment. I'm not talking about intervention, I'm talking about treatment. Later in other video, I will be talking about intervention, but this one I just want to talk about different type of treatment, which is, like, it's broad. So, and there's no number one, number two, number three, because all those things can be combined. One, you can do one of them and then you're able to take care of your mental health, or you can do all of them. So one of them is medication. So if you are diagnosed with a mental illness, they're probably encouraging you to take medication depending on the severity of the mental health. Again, just like a physical health issues, maybe you were diagnosed with diabetic or pre-diabetic. You don't need medication yet, but they're encouraging you to lose weight, eat healthy, certain things. But when you get a severity of diabetic, they might encourage you to take a certain medication. So it's the same way with mental illness. Depending on the severity of the mental illness, you might need medication. So medication, the next one is therapy. Again, I know therapy, it can be very hard for individual, which is why to be so, because therapy is a hard thing. Can you imagine, like, you go to someone week by week, hour by hour, month by month, letting them know, like, not only letting them get to know you, but letting them get to the little voice that no one hears, so they can see what is really going on, so they can teach you ways to take care of your mental health. So that is very tough. It is very, very, very tough to allow someone to do, because that person have to go inside of you. And sometimes even even you is afraid to really see who you really are, and then for you to allow someone to do it. So it's very tough, but that's one of the treatments. Another way you can treating, or you can taking care of mental health, it's therapeutic activities. There's quite a few different therapeutic activities that can help with mental health, like journaling, mindfulness, self-care, physical activities, hobbies, reading books, so meditation. So there's quite a few therapeutic activity that can continue taking care of your mental health. In other ones, it's having a higher power. Whatever your higher power is, believing in something that's outside of you. I'm a Christian, so I believe in God, but believing in something that's outside of you, learning different skills, having different skills. Sometimes you might want to learn how to express your need. Sometimes you might want to learn how to communicate effectively with individuals. Sometimes you might even learn how to have a good night's sleep, some sleep routine and sleep schedule. Sometimes you might want to learn boundaries, healthy boundaries with other people. So there's quite a few other skills you might need to learn to be able to take care of your mental health. And some of the skills too, not only you taking care of your mental health, you're also taking care of your physical health, because those things are really hand in hand. some lifestyle change or some type of change might help you taking care of your mental health. Exercise, and I mentioned that, nutrition, the way you eat certain things. I know you probably hear, what we eat, we are what we eat. Sometimes those individual things, because there's certain things that we eat that can creating different things in our body, dopamine, sertraline. So that can create, there's certain foods that can create in certain things in our body that's giving us certain things to help taking care of our mental health. Having purpose, having goal, doing meaningful and rewarding activities are some of those treatments that we can do to take care of our mental health. So like I mentioned, today I wanted to talk about three different things. Some language you might hear, some phrase, some words you might hear in the mental health world. Some of the providers that might be a part of mental health. And I wanted to say there's other ones, like your primary physician can be a part, nutritionist can be a part in your team to taking care of your mental health. But those are the main ones, the one that I mentioned. And then some treatment that you might need to take care of your mental health. Like I mentioned, in every video, I'm going to end our conversation by providing a dose of self-care for you to either you can implement in a day, in an hour, or throughout the week. But I wanted to leave you guys with some part of self-care. And like I mentioned in other video, I normally open the doors in the Creole one, so I already have it open. And when I do the second video in English, it's already open. Maybe one day I'll open it in the English one, so you guys can feel special as well. But I already opened it in the Creole one, so it look like this. Just so you guys will see, it look like this. It's like a little pill, but I already opened one, and I want to leave the same one from the Creole one. And then this one say, be proud of how far you have come. There is no stopping you now. Be proud of how far you have come. There is no stopping you now. So exactly what this is saying. Sometimes we be ashamed of what we have done, or our past, or where we come from. And I normally say, your past, who you were, it's what carry you to be who you are now. And sometimes we have to be kind to it. You have to be kind to the little girl of you, because that little girl carry you to be this adult now, or this adolescent. It's the same way, like where you came from actually is the one that's leading you here. So be proud. Find wherever you come from that you are part of, and this is not a stop. Keep going. Thank you for listening to me. If you like this video,